next presenters is actually a team presentation for Poetry for Personal Power, and I will try not to pop my peas too much. Please welcome the team.
So quiet in here. How's everybody doing? We're poets, so we like to project our voices and give off energy.
Where are you from?
St. Louis,
Denver,
Rochester, New York.
our MedStarter support suggests that Poetry for Personal Power is one of the most innovative ways to improve care for those who deal with depression. Simply put, we use art and peer support to show that emotional distress can be both temporary and transformative. Studies have shown that the peer support is the most effective mental health intervention, and there's a 70% reduction in hospitalization when peer support is implemented. What's novel about our program is we use both formal and community support. As a training system, we provide our clients with a three-pronged approach where basically we take an artist to teach expression and community integration. We take a peer specialist who talks about recovery, and we also use a wellness coach to implement those procedures. Our business model is very simple, it's repeatable, it's accessible, and we train them, they implement it, and then we evaluate. Our program is already being used in schools, juvenile detention centers, and shelters across the country.
our artists connect people with a variety of activities that are part of this huge, untapped social justice youth network. For example, there's a poetry scene in every major city in the United States, which hosts community events throughout the week that provide a space to speak freely. Poetry and all arts teach expression to people and how to troubleshoot their problems in an interactive way. When I was 5, my father murdered my mother. I was traumatized, treated like a ticking time bomb, just shuffled from therapist to therapist to the point I was desensitized rather than recovering. Until high school, I found spoken word, and immediately I was integrated into a local and international community of people who are focused on turning their pain into a transmutation of self. Now I'm a nationally touring poet, making these same changes all over the country. I hope poets add small tweaks to their network to make it a peer support intervention, and then artists like me can help people come back into themselves.
Let's talk a little bit about feasibility and scalability. We're already alleviating patients' depression and lightening caregivers' loads. We're contributing to a growing body of evidence that validates peer support, and we've received unprecedented levels of repeat funding from SAMHSA. Our founders are executing strongly in 3 states with interest coming from 4 more. With the right public health guidance, tech could be a huge accelerator for us, and unlike a lot of other tech health plays, our implementation issues are trivial. Some great ideas are destined to succeed because they're simple, low cost, and effective. I don't know about destiny, but we are all 3 of those things. All this creativity works in public health terms because it keeps at its core the simple, well-validated messaging we keep talking about. And what that means to the creative people who come in to participate is that they can customize both the classes and the object instances they spawn from them to their heart's content, to put it in Silicon Valley terms. And that's why, with a few simple adjustments, this could be a worldwide tool to fight depression in short order.
Technology is ever evolving while the human experience is becoming extinct. More people are existing only in the cyber world, which increases major concerns for the young adults we serve. Poetry for Personal Power weaves all 3 prongs of peer support to plug people back into their community. According to a study by Scott Miller at KU, 85% of the benefit of therapy is relationship building. An app can provide 15% of the benefit, but our niche in connecting humans provides 85% of the benefit. Our network building is simple, yet it provides a 455% return on investments for HMOs, ACOs, and health homes. This gives us a ready customer base and a large profit margin. Our friends at AsReady say we are the human app. Thank you.
Questions?
Thank you, guys. I may not be a poet, but I think the judges may have questions, and they know it.
You sure?
I'll be here all week.
Love the idea. Where's the ROI coming from ACOs? Where's the frame of reference there?
I'm glad you asked. The ROI numbers we're coming from are built on a diverse evidence base we've contributed a lot to. And it's basically the idea is that if you integrate your communication subtly into the community, you get reductions in hospitalization. So we have some roughed up numbers here. And based on 5 inpatient days saved per year at $1,000 a day, again, $75 per month subscription cost to support this really simple program, you're ending up with about $450 coming back to you for every dollar you put in. There's also ROI built in from the other side for investors that's, I think, competitive with pharmaceutical returns, which hardly anything else is. I'll stop there, though.
One of the interesting and intriguing things about your team is that you're diverse in terms of geography. You're across the country, and I think that that's a very huge strength of your team. One of the interesting things in cultural psychiatry and mental health is just how unique the patient populations are. And I'm wondering, how are you going to address the individual needs of, say, the Hmong community or the Laotian communities who do face depression but require the peer support for their SMI or depression?
That's a great question, and it brings up another form of ROI and benefit that I think we haven't really hit on. The basis of this program, if you look at how the money is spent, you have a statistical return thing we showed you, but what's happening is that we're paying creative people to go into their communities with targeted messaging, and they can be the Hmong populations, people who are refugee populations, who do it on their own terms. What keeps it disciplined is just a simple messaging core that makes sure you have traction. And because you're paying the people in the community, you're increasing the community's resilience directly on top of that.
One more question.
I'm part of the Walking Gallery, and we wear patient stories on our backs to move healthcare forward. So I love that you're actually moving the voice forward instead of like hiding it on the back. So yay. What's the biggest challenge you see going forward? What would you use if you were funded? What would you use the money to do?
If we were funded, I think the first challenge, the biggest challenge is spreading the culture carefully. Everybody wants to grow quickly. Everybody likes to make their numbers and serve their exponential functions. This is really so human at its core that the key thing is being patient and letting relationships grow at a human pace. So the money would go right back into what we've already been doing for the past 6 years and developed a practical proof of concept, and just, it would be a great amplifier.
All right.
And we are the human app. Yeah.
Thank you to the team for Poetry for Personal Power. I will keep us moving along in this hour.